just before we get into this episode, we are obviously going to touch on medical conditions. Now, whilst extremely rare, there are people in the world that evidently do suffer with these particular conditions. So we just wanted to make sure that we stayed respectful with the way in which we covered them. But we were naturally going to talk about the way in which they were researched and kind of all of the public opinion that kind of came along with it, because we'll talk about some news stories, research, that sort of thing. Hello, and welcome to another episode of Casting Views, a podcast where we take something each week and we'll cast some views. Could be something random. In actual fact, this month it's relatively unusual. But prior to getting into that, sorry,
Nice.
wait, hang on a
I see
minute.
what you did there.
Hang on a minute. Who are you?
I'm Dan,
Oh,
actually. Yeah,
yeah.
well done. Yeah.
And I'm Lou. I feel like I've done that intro really backwards, but hopefully it might mean that I'll get the outro right this week. Prior to getting into our topic, we have a promo from some podcast friends of ours, and that this week is going to be Unchefed. So I'm going to pass over to them.
Hello, everyone. This is Brendan from the Unchefed podcast. Each week on Unchefed, we unpack a topic regarding the politics and history of our plates in the hope of becoming better eaters. That's Unchefed, available now on your preferred podcast network.
And we're back. So this is week 2 of Unusual Month, which is
We
good.
got that the right way around.
Yeah. We didn't get it right. Was it Food Month, where it was just like, oh, this is week 65 of
It
Food
was
Week?
food, week, month, day,
Yeah.
hour. Yeah.
So this month there's a focus on kind of like the weird and wonderful, or the unusual and strange, I guess is the way you put it.
Yeah.
So last week we touched on laws, rules, regulations that were just a little bit unusual. And this week we're going to talk about medical conditions and like medical phenomenon, I guess.
Yeah. I think that's fair.
I feel like we need to put a caveat out because we have been discussing this. We will talk about what is evidently like strange and unusual medical conditions, but evidently people in this world will suffer with them. Whether or not any of our listeners will, we don't know. And if you do, please do reach out to us. But obviously, I think in the way that which we talk about them, we're coming at them from the perspective that they're just relatively unusual in terms of strange and unusual that you just don't see kind of day to day.
We're here to kind of, like you said, cast a light on some of the more unusual things,
Yeah.
as opposed to, like you said, your day-to-day things.
Yeah. So that's the way that we'll get into it. So do you want to kick off, or do you want me to kick off?
I'll let you kick off. I
Okay.
think you've
Now,
introed it so beautifully, so you can
yeah, I
go for
have.
it.
Yeah, I butchered the introduction. I'll butcher the bloody outro as well now. The first one that I've got is Jerusalem syndrome.
Not heard of that.
Oh, really?
Yeah,
Okay.
no.
Now,
Well, explain it. I might know it, but yeah, I can't say I've heard it as the name.
now I heard of this separately to doing the research for this episode, because I once saw like a little like 15-minute, I don't know if it was like a Vice thing or something on it. And this basically is a mental phenomena that basically makes somebody or puts somebody in a state of psychosis when they visit the city of Jerusalem. So their behavior basically becomes erratic, themed around religious ideas when they arrive in Jerusalem and or spend time in Jerusalem. There are actually statistics about how many people were affected by this, and there were admissions to hospital of up to 100 people a year for this particular
Wow. Well,
condition. And basically people for it's stated that usually people recover within kind of 3 to 7 days and feel kind of ashamed of their behavior and that sort of thing. But it includes like irritation, a want to wear white robes for some reason. Yeah, it basically puts you into a kind of like a psychotic trance almost. Really strange. There are individual cases of this that you can read about. I don't feel like many of them are particularly well done, and I think that's because there's a level of like stigma that comes around this phenomenon, because it's not
okay.
something that people are necessarily outwardly willing to talk about if they've experienced it. It's actually staged. It's actually typed as well. So there are lots of conflicting reports about whether or not it's a legitimate thing, or whether or not people that are affected by Jerusalem syndrome already have some form of psychotic illness that already exists, basically. So there's three types of Jerusalem syndrome, and I'll define them all for you now. So type 1 is Jerusalem syndrome imposed on a previous psychotic illness. So this basically is just referring to people that have already been diagnosed to some form of psychotic illness prior to their visit to Jerusalem, or they've gone to the city because of like already a heavy influence of like religion and I guess kind of like a sense of like salvation about them almost by visiting what
Yeah.
is traditionally seen as Christianity's like most holy place. There's type 2, and this one is I'm going to struggle with all the wording here. Jerusalem syndrome superimposed on and complicated by idiosyncratic ideas. So it doesn't necessarily take the form of a mental illness and may
Oh,
simply
right.
be a
Okay.
culturally a cultural obsession with the significance of the place, either as part of like a group or an individual. And then type 3 is basically where a person who's had no previous history of mental illness becomes psychotic upon arriving in Jerusalem. And that is, again, where they've just turned up absolutely sane as a tourist to see Jerusalem, not even necessarily particularly religious. And they just could turn into kind of like they go into like a psychotic kind of trance while they're there. There was a study that was done on 42 cases over a period of 13 years, and they were never able to confirm as to whether or not the condition was temporary. But it's
Right.
again reported that most people, sorry, skip out of it between kind of like 3 and 7 days. So there's a period which is 13 years. So it's 1980 to 1993. And this is the Kafar, again, sorry if I butcher the pronunciation, the Kafar Shoal Mental Health Center in Jerusalem. So 1,200 tourists with severe Jerusalem-themed mental problems were referred to the clinic, and of these, 470 were admitted to hospital. On average, 100 tourists have been seen annually, 40 of them requiring hospital treatment on average.
So I think you sort of said it in one of them. Do we think it's like where they are so what's trying to use the right words, like excited, or their mind, they've just been devoted to wanting to go there for so long? And is it that their mind just gets overtaken with happiness, excitement?
Yeah,
Do you know what I mean? That
yeah,
it just overworked once they get
yeah.
there.
This is the thing. I think the strangeness about this one for me is the fact that they have taken studies, and evidently the type 1 and type 2 are people that have either had kind of previous mental illness or kind of disorder. Now, I think the strangeness about this for me is that the most common form is type 3, where it's just a person that's never had any issue before, not necessarily religious. And for me, that's a strange thing. I don't know if it's because you build Jerusalem up, because obviously, when you look at it, like I said, from the like perspective of Christianity, it's one of the most holy places in the world, or is the most like holy place in the world. I don't know whether or not that just has an effect on a particular number of people, because I guess you have to balance it up against the context of how many millions of people visit Jerusalem every year. So when you
Yeah.
look at the incidence of 100 people are admitted to hospital because they're so, I guess if you were to put it in the context of they're so overwhelmed by the place that they are, where in the place that they are, of the 3 million people potentially that go to Jerusalem every year, that's actually not a particularly high number of people in terms of a percentage. So I guess it's just a very strange phenomenon, and everybody agrees that people do go into kind of like a psychotic trance of the people that are admitted to hospital. It's a very, very strange phenomenon and or psychological condition.
That is unusual. I guess what I was trying to say, could it be for a lot of people? I want to, when I say trip of a lifetime, what I don't mean like, oh, it's in a holiday term, but like that, like you said, that is a destination for religious reasons or what have you
Yeah,
that they really want to go to. And once they're there, they just become overwhelmed, I think is what I'm trying to say.
yeah, yeah.
And maybe that's how it manifests. Has there been any study in terms of like age or
No,
any
nothing
details?
specific in terms of age, but again, I think it's because it covers people of all like backgrounds. So there's no kind of specific average when it comes to people under 30, people over the age of 60, nothing like that.
Okay.
But yeah, it's like even like I said, it's strange because like some of the symptoms of Jerusalem syndrome are turning around and saying, well, it's like irritability, it's lack of sleep. But again, like it's strange things like the willingness or the want to wear white robes. And then there's a
Yeah,
load of
yeah.
religious kind of theme symptoms that kind of fall in there as well. It's just a very strange thing. And I think that I'm kind of more sitting on this one as a case of people get to Jerusalem and are more so overwhelmed by the place that they are, given that they've
Yeah,
built it
yeah.
up as being, the center of Christianity.
I think it's that build up bottling of emotion probably until the moment you get there and you see it for the first time, or you get there. Yeah, I guess that's where I'm coming from.
Yeah, that's the thing. And so I think to myself, we've all been in like a stressful situation potentially that has made us behave in a way that's, irritable or, that sort of thing. So I guess is it maybe just the opposite side? It's like the euphoria, it's all of the emotion that comes along with that all of a sudden kind of puts you
Mm.
in a kind of like state of like I guess kind of like shock, maybe. I
Yeah,
don't know. It's just a strange one. But like I said, it's weird because the symptoms in terms of like the white robe thing kind of falls
that
alongside
one,
all
yeah,
of
I
the
couldn't
yeah.
explain. Yeah,
But when you look at the list of symptoms, and so when you look at the symptoms that fall across all the categories, so if you look, it's some of the symptoms are identifying with a character from the Bible,
okay.
magical ideas concerning health, sickness, and healing possibilities connected with Jerusalem. There's identification with particular religious or political ideas that kind of all of a sudden onset. It's very strange. And then there were pictures of people that are dressed up as Jesus and were like preaching in the streets as if they were Jesus, but not from a perspective of like, oh, you go to London and someone dresses up as a royal guard because they want to make change, as in somebody is sat in the street genuinely believing that they are Jesus.
Right, right.
Yeah, it's a really strange phenomenon, if you want to call it a phenomenon, or disorder if you want to call it that. But yeah, like I said, there's thousands of people that have been like diagnosed with it, and hundreds of people that have gone to hospital. So it's evidently a thing. It just kind of depends on what side of the fence you sit as to whether or not you actually think it's some sort of medical condition, or if it's just something kind of brought about by the fact that they're in Jerusalem and they're overwhelmed.
I think, I mean, when we come on to mine, let me know when you want to do that. I've only got two, and one of them is something that is centered around the brain and the mind. And I think, I think go back to one of our early episodes where I think I was talking and saying that ultimately the brain is wired a certain way, and these subtle little changes can affect kind of how we perceive things or how we think about things. And I don't want to sort of speak for your list, but I'm guessing there's probably a couple on your list that may be in and around how people perceive things
Yeah,
or react
yeah,
to things. So it's the kind of the human brain, the human body is just still amazing even to this day in what it can do to
yeah.
the person.
Yeah, a very, very, very strange one. But again, like when you look at it, it talks about so it's not funny. It's funny in the context of it's a strange thing. Declaration or the desire to split away from a group or family and tour Jerusalem alone. So basically, people that have this condition while they're there also decide to basically say, I need to do it by myself. They go on like marches between particular destinations. And again, this is where the togas and bed sheets come from. They use hotel linen to make toga-like gowns, and again, this is
Mm.
consistent amongst a number of people. They shout and scream loud verses from the Bible that they've then gone out and learned. Very, very strange. Never, I don't think I've known anyone to experience Jerusalem syndrome, but I've heard about it prior to doing the research.
Ah, no, I hadn't.
Kind of makes me concerned to visit Jerusalem, just in case I'd like, that happens to me.
Well, that's the thing with a couple of things, and I think the couple of I've got that it is very much you don't know if you could be affected by this or not.
Yeah, yeah. And I feel like people that might have been affected previously will have gone to Jerusalem thinking, oh, yeah, absolutely normal, fine. And all of a sudden had that been admitted to hospital and then come out thinking, what actually happened to me?
Yeah, yeah.
Yeah,
Wow,
very
wow.
strange. But yeah. So what have you got for me?
Right, I've got, like I said, I've got two, but I've got quite a bit on each one. So we might go into this a little bit. But my first one is, and I chose it because I remember seeing it on the news a couple of times over here, and it's foreign accent syndrome. I'm gonna stick specifically with foreign accent rather than, I know there have been examples where people have woken up and kind of spoken a different language entirely. I'll probably refer to it as FAS from now on, FAS, because it's going to be said a lot of times. So it's a medical condition in which patients develop speech patterns that are perceived as a foreign accent. So it's got to be different from their native accent without having acquired it in the perceived accent's place of origin. The cause of it is often related to potentially damage to the brain. So it could come from a stroke, head trauma, migraines, or developmental problems. And the condition might occur due to lesions in the speech production network of the brain, but it can also be considered a neuropsychiatric condition. Now, the actual first case of this written reported was in 1907.
Okay.
So yeah, it's well over 100 years. And between 1941 and 2009, there were 62 cases, so or recorded that is. So it's not that there's a huge amount of cases, but there do seem to be it seems to be a consistent syndrome.
Is the 62, is that worldwide or is that UK?
I think it's worldwide because I look at the history. Oh, and one of the key things for this is that, yes, so its symptoms result from a distorted articulatory planning and coordination process. And basically, it's got to be, as I said to you earlier, it's got that it's the person speaks in their native language, but in a different accent. What they have said is there's been no verified case where a patient's foreign language skills have improved after the brain injury. So it is very much a temporary.
Right, okay.
So, to answer your question about around the world, it's still very rare. And in fact, they said in 2018, so a little bit more recent, they estimate that there's only as few as 80 people had it currently in the world at the time.
Okay.
So for this reason, doctors study people as much as they can to then publish the results. And I've got a couple of proper sort of in-depth examples, but over the years, there's some interesting things here. So one of the earliest cases involved a Norwegian woman who was hit with shrapnel during World War II.
Okay.
She then developed a German accent. Now, due to brain damage. Now, I'm going to come on to it later, but one of the things that's really unfortunate, and especially for this lady here, is that she was then shunned by the people she lived with and
Right.
her town, especially you can understand in that time.
Yeah, well, I was going to say it's unfortunate that she's decided to pick up, well, not decided, she's picked up a German accent, given the nature of the time and how she sustained her injuries.
Yeah, yeah, no, absolutely. And there'll be more of it later on, but there was a case in 2016 that detailed the story of a 34-year-old African woman whose doctors related her foreign accent syndrome to schizophrenia. She showed up in the emergency room with a British accent despite never having lived in Britain. She had faced immense financial and emotional distress in the months before the visit to the ER, and doctors had diagnosed her with schizophrenia. In 2018, a 65-year-old Spanish-speaking woman with multiple sclerosis began speaking in Spanish with English accent, and there'll be a little bit further on. There'll be again some of the reasons because MS I found really unusual. This example says why it could be a cause, and it says MS destroys the myelin that coats the nerves, disrupting their ability to send signals.
Okay.
And I'm going to skip this one because I've got it in a little bit more depth later on. Yeah, it was a doctoral scientist called H. Whitaker first coined the term foreign accent syndrome in '82. So even though the first case on register was in '02, it was only in '82 that the term foreign accent syndrome came into being. And again, he confirmed that for it to be strictly that, the person must be monolingual, so they can only speak one language. They must
Right.
have had they must have had damage to their central nervous system that affects their speech, and their speech must be perceived as subjectively sounding foreign by themselves or clinicians. So again, a lot of this is all about it being perceptual rather than they can absolutely say, yeah, that's an Italian accent or that's an American accent.
Right. Okay. Okay.
Most people with foreign accent syndrome show symptoms of psychological or neurological condition.
Do you know if it's specific within a particular culture? So if it's like Western cultures.
No, the only thing I have seen some stats here, but it says it's more commonly pronounced in females than it is in males. And I think all the examples I gave above, they were all female.
Right.
So in a meta-analysis of 112 patients with FAS, 97% were adults and 67% were female. The typical age range for the disease is around 25 to 49. And this is the thing, I wouldn't have even thought about this, but in cases where handedness was recorded, the majority of patients were right-handed. I know, and that's the thing that you don't think about. So they said only in 12.5% of cases did the patients have previous exposure to the accent they later seemed to develop. So what's that? 87.5% had never even been anywhere near the accent that they start speaking or taking on.
That one's strange because you'd feel like it would need to have been acknowledged and or learned at some point, don't you? Because I think in the media there was It was a few. When I say a few years ago, it's probably like 8 or 9 years ago now. I'm pretty sure that there was a woman in the UK that had woken up after like a coma and began speaking in a Chinese accent, and she was on
Yeah,
like
and it might
ITV
be, is
News.
that, it might be the one I've got. Do you know what? I can't remember. But I've even seen here people that wake up with a different regional dialect. So someone from the south starts speaking Geordie, which for American listeners is at the north, from the north of England.
Imagine going to bed talking like this and then waking up going, "Why, man?"
Yeah. So even domestically, regionality comes into effect. Since it is very rare, it takes a multidisciplinary team, so they have to have all kinds of doctors and psychologists and neurologists to do it. And just like the one you mentioned, there are four types of FAS. So you've got, and again, like I said, I hope to say these all properly. Neurogenic FAS is where it occurs after the central nervous system has been damaged. Developmental FAS is used where the accent is perceptible from an early age, e.g., children who have always spoken with an accent, which I find fascinating there as well.
Right. Okay.
Psychogenic is used when it's psychologically induced, associated with a psychiatric disorder or clear psychiatric traits. And then the final one is mixed FAS, where patients develop the disorder after neurological damage, but the accent change has such a profound impact on the self perception and identity that they'll modify or enhance the accent to make it fit with the new persona. So that's why that introduces a psychological element there.
I feel like it would be interesting to have somebody interviewed who's got this condition.
It's like I said, I really wanted to look into this because again, I'd remember seeing it on the news, and again, we'll come on to it. It's about how people are affected by it, and so initially, the press it's reported as, oh, it's a funny thing. Someone from the South of England has woke up speaking Geordie, or someone from America is speaking English, but it is what they go through, and I'll come on to it after. People assume that they're doing it just naturally and aren't thinking about it. But they are saying that the person suffering from it does actually know that they're doing something different. So it's not a natural thing to them. They're aware they've got a speech problem.
Right, so I guess in that sense that you're considering it from the perspective of like if somebody slurs speech because it's literally a physical thing that cannot be changed almost, isn't it? Because the way in which you pronounce words is a physical thing, obviously with the
Yeah.
nature and way you move your mouth. So surely it must just be like in the nature of like, oh well, again you said after brain injury. So let's say that somebody has a stroke and has like a partial paralysis, they slur their words potentially. I guess it's to be considered in the same vein as that, really, isn't it?
Yeah. Well, a lot of we'll come on to it. Main treatment really is like speech therapy again, and training. So one of the fascinating things I've seen here is they've said one of the symptoms of the syndrome is that the patient moves their tongue or jaw differently while speaking, so it creates a different sound. So it is like something fundamentally has changed. So it's not them mimicking an accent, as I think, like we're saying, how something has changed to make it sound like they are.
Yeah, yeah. Because I think that's what you said at the very beginning, wasn't it? It's not necessarily that they're turning around and their brain is impersonating the accent. It's characteristics of words that make them sound like a particular
Yeah.
accent.
Yeah, and treatment involves intense speech therapy, and about a quarter of FAS patients go through remission after treatment. Now, I've got two cases here. I'll go through them quickly. Karen Butler from Illinois. She went in for dental surgery, but the article here says she left with more than numb gums. She also picked up a pronounced foreign accent. She's never traveled to Europe or lived in a foreign country. She's an American, she says, born and bred, but she doesn't sound like one anymore. Her accent is a hodgepodge of English, Irish, and a bit of other accents.
Right.
Yeah, it started a year and a half ago when she was put under anesthesia while the dentist removed several teeth. I just went to sleep and I woke up, my mouth was sore and swollen, and I talked funny. And the dentist said, "You'll talk normal when the swelling goes down." The swelling went away, but the foreign accent didn't. And a neurologist in Portland diagnosed her with foreign accent syndrome. And again, they said it's usually associated with brain injury or stroke, something similar to that. Just want to scoot down to the end. They're saying that she may have suffered a small stroke while under anesthesia, but she won't know for sure unless she has a brain scan. And unfortunately, she says her insurance company won't pay for one. In the meantime, it's possible that she can get her American accent back through intensive speech therapy, but unlike other people with FAS who become depressed by their change in accent, she quite likes a new one and said it's made her more outgoing and a good conversation starter. So that is one take on it. So at least she's taken it in a way, I guess, she's saying she's got it now, so she's going to live with it. This one I think is one you may have mentioned. So Julie Matthias, despite having lived in the UK her whole life, she found that she no longer speaks with an English accent, she now sounds French or Chinese instead.
Yeah, that's the one.
Yeah, and now she's had it for 4 years. So 4 years ago was the last time I heard my own voice. She's one of a handful of people in the UK with the syndrome, and although their speech is completely fluent, their voices have taken on odd characteristics that make them sound as if they grew up in another country.
Can I just say as well, just before you go any further, do you know what one of the worst things about this condition is? Is the fact that anywhere that you go, depending on the accent that you've got, people must think that you're taking the piss.
Yeah, yeah,
As in, like,
potentially.
wherever you. So, for instance, like this woman, I imagine, is an English woman.
Yeah, yeah,
Yeah,
she's English. Yeah, yeah,
and so she's taken on potentially a Chinese accent. You can imagine potentially being in the wrong situation in which
yeah,
people
yeah,
would be horrifically offended in the
yeah.
way in which you're talking, when in actual fact it's actually a physical condition.
Especially when it's so rare.
Yeah, that's the thing. How do you explain that? If you walked up to somebody in the street, you said, "Oh, I'm really sorry for my accent. It's or the way I'm speaking. It's because I've got a rare medical condition that only affects 65 people that are living right now." There is no chance you'd get away with that. I just don't think anyone would ever take you seriously.
She believes hers was caused by a car accident that was followed by blinding migraines. She said her brain felt like it was going to explode, and her joints are so tender, so painful you can't breathe. She said about the migraine, she'd rather have more babies than go through pain again. She said, and then yeah. So basically, she said when after a few months these painful episodes started, or sorry, a few months after these painful episodes started, something even stranger happened, and her voice started shifting accent. The change soon caught the attention of people in her beauty salon, and clients talked to her as if she didn't understand English anymore. So yeah, just because the fact she had that accent, they were talking to
Yeah,
her like she was foreign.
yeah.
So they said they can't do it. They don't know what's happened. There was a I've seen it here. Basically, yeah, compounding the issues with identity, people often have to deal with surprising and sometimes unkind responses from those around them. Accents are an important way for us to form boundaries between social groups, and accordingly, some of the people in someone's created a book of this. They report feeling marginalised, like a foreigner in my own country. Someone has said, and they've even experienced racism. And one person who suffered said, "I had a taxi driver try to charge me double fare for a journey I've taken before."
Wow.
Yeah, and two bus drivers. Another one said two bus drivers treated me like I was deaf, stupid, and belittled me. And even friends can start to feel suspicious. So yeah, people who have got it have suffered. They call it here, yeah, unkind responses and potentially racism. Yeah, but imagine taking a taxi for a journey you've done, and then your accent's changing, and you're being charged double fare for the same journey. So one of the things, yeah, they've said is that often you can't treat this directly, but it might be a sign of something underlying neurologically
Right.
or within
Okay.
the body. So often people may go under investigation for that. It may have maybe come on from a blow to the head or face, surgery to the face or brain, multiple sclerosis, brain tumors, or migraine. And yeah, I'll finish with yeah, in 2019, an analysis of 49 people with the syndrome found that the most common linked conditions were severe headaches or migraine, stroke, surgery to the face or mouth, and seizure. Of those 49 people, most reported having a foreign accent for 2 months to 18 years, with a mean length of 3 years.
Wow.
So,
18 years is a long
18
time.
years. Yeah, yeah. Like I said, I chose this because I found it fascinating at the time because initially people can see it as a not as a joke story, but it's seen as oh, it's so what
Someone's
they're
putting
talking
it
in a
on.
different accent. But it's a fact, like I said, and I've missed can't see the line, but it's like people are saying that yeah, they are acutely aware that they're speaking in a different voice, which gives them even more trauma
Yeah.
and that they are, like you said, they are treated badly or differently by those around them.
I feel like it's difficult to explain as well, only from the perspective of the doctors and the research that's been done into this turns around and says, oh, this is usually the way in which it occurs. But in reality, are we completely sure about how this happens or how that happens, and what necessarily immediately causes it. I think that must be a difficult thing to try and explain, because I think, if I remember rightly, when the lady had the story with the Chinese accent, I'm pretty sure that that went viral on places like Twitter and Facebook, and all of the comment sections were filled with "she's just putting it on." But
Yeah,
in and of
yeah.
itself, I guess it's like the context of why would you do that, number one, but also number two, it's like a registered, recognized medical issue.
Well, I remember as a kid first seeing Tourette's on TV.
Yeah,
And again, that was seen as a similar thing. It was like
yeah,
they're putting it on.
yeah.
But
Uh,
now it's more common, it's more known.
Yeah, I think you've had more exposure to Tourette's as well, because I think people in like mainstream media have we've had programs about it on television. We've seen
Yeah.
TV personalities and internet personalities with Tourette's as well. Because I think that's what it was. It was always seen as like a fad, and it was like a laughable thing almost. Because I remember they had the programs following people with Tourette's, and they just used to clip together basically like the most inappropriate like swears or like ticks together for a 1 hour episode, but that made it look like it was just a case of like, oh, this is something entertaining, basically, as opposed to
And
like,
that's it. And it was like, oh, it's all, oh, they're just trying to swear and get away with it. But they don't also then see the body ticks that come with it
yeah,
and
yeah,
how stressful and tiring those must be as well, and they don't see that part of it. They, the media, I think, at the time were just portraying, how do I word this? By just airing the swearing, made it look like it was a silly,
yeah, yeah. They presented it in a way that wasn't something that you took seriously. They presented it in a way that was supposed to be entertaining, as opposed to
yeah.
this is what this condition actually does.
Yeah, and actually, sorry, I've got one more thing on this. I did find, so it was the one I said at the end about the taxi journey in the bus. It was this British lady, sorry, but there's also an element here. So she said she also found it difficult to look at her own reflection because she didn't see herself as herself anymore because she spoke in the accent. She said she was even finding it difficult to look at herself, her own reflection. But what I was going to say was, and it's something, this just highlights something they do with brain surgery as well. So they said basically what it is it can also be the rhythm of which you say something. So this journalist was saying, as I speak to her, I can see why mistakes between what accent is created. She pronounces accent with a heavier emphasis on the second syllable. That reminds me of my French teacher, but the staccato rhythm might sound like a Chinese accent. And it's this bit here, right? They said often the subtle signatures can be traced to no neurological damage. For instance, Barbara Tomasino, who's based in the University of Udine in Italy, recently examined a patient with a brain tumor. Sometimes she sounded like she was South American, sometimes she spoke with an English accent. It was a very strange way of speaking Italian. The patient, and it says here, the patient was awake while a surgeon operated on the tumor, allowing researchers to probe the electrical activity and functions of the cells around the cancer. Although it sounds painful, this is standard procedure that helps a surgeon work out where the tumor ends. Combined with MRI scans, watching the neural activity in this way, it also allows them to detect the cells involved in controlling the mouth and larynx. So by pressing on that region, the tumor may therefore have been disrupting her ability to plan the complex tongue and mouth movements needed to talk normally. So it's that thing about operating on the brain while the patient is awake.
I guess it's like an active thing of seeing how or not how that person is affected, because you're literally getting like a window into the computer that's controlling it all. Like I said, I think that this was always, when it was portrayed in the media, seen as a bit of a joke. But knowing, again, I've never really looked into it properly. I just know that I've seen stories of it, whether or not it was something that I knew was something that was recognized as a medical condition. But it must be a scary thing, because you're waking up, and I guess it's like losing what is almost like a basic function that you would have just had and never valued it like that. Imagine waking up and the voice that comes out of you isn't your voice.
Well, that's it. You've grown up. I mean, you're what, sort of 20, 25, 26. You've been you for 26 years.
Yeah, yeah.
And then all of a sudden, tomorrow, you're someone from South America.
Yeah, because when she said and talked about the fact that she looked in the mirror and it wasn't her, it's almost like body dysmorphia. Is it? I don't know if body dysmorphia is the right like phrase to use, but it's like it's almost kind of created a sense of like dysmorphia in the fact of she's looking at herself and actually feeling like an out of body experience, because the person she's looking at has changed, because a physical trait of hers has changed, and that must be a scary thing.
Absolutely, absolutely. And I think the fact is that we're talking about it here, which obviously means, and the fact is there's over 100 people or so, etc., who've had it documented. It's a fact that it is a possible condition and it sounds like it could happen to anyone, but it is so rare that a lot of people don't know about it now, and it is still treated by some as a joke condition. And I think that's a horrible thing because it could happen. It feels like it could happen. It is ultra rare, granted. From everything that it's saying about how it can come on, it feels like there is a chance that anyone could have it. It's not that, like you said, certain percentage of either the world or a certain culture or a certain region can have it. It could happen anywhere to anyone.
It's a very strange one. I feel, yeah, again, do you know what it is? Do you know what I think slightly not scary about all of the things that we might talk about is the fact that, again, there's no rhyme or reason behind any of the people being necessary, apart from the fact that 67% of them were women. But it is true. It's like one of those things that could potentially affect anyone. Imagine having a car accident and then you are that one in a million that
Yeah,
is,
yeah.
yeah, scary, scary. Because again, the 100 people that are dealing with it now never would have thought that in any instance that would have been them.
No, no. And on the flip side as well, could you imagine if you've had it for 4 or 5 years and then it goes, are you readjusting again? I mean, you must at that point. I mean, whoever had it for 18 years, does
Yeah,
that
that
not
is the
become
new.
you? That
Yeah, that is the new
yeah.
you at that point. Then imagine it subsiding after 18 years and you going back to sound the way that you did before.
So like I said, yeah, that's foreign accent syndrome.
But like I said, it's strange because it's almost like the physical aspect of speaking in a different way then creates mental issues
Yeah,
because of the effect that it has on your mind. So it's
yeah.
quite a
You break
scary
your
thing.
arm, or you break your elbow, like you did a few months ago.
Yeah, yeah,
You put it in a sling. You
yeah,
can't use that arm for a bit,
yeah.
but
But you know
it
it's
comes out the
still there and
sling.
it's
Yeah,
coming back. Yeah.
yeah. Whereas, yeah, this all the other things, and no one's going to treat you very differently or differently because you've got that arm in a sling.
Yeah, yeah, yeah.
But yeah, but imagine if you break your arm, you go in a sling, and people are trying to charge you more for a taxi ride or a bus. Do you know what I mean? You,
Do
you
you know
wouldn't
what?
you wouldn't do
I,
that, right? You
I
wouldn't.
think that says a lot more about society, just in
Well,
general,
yeah, yeah,
evidently.
yeah, yeah,
Honestly,
yeah,
could you imagine?
yeah. Anyway, sorry. Over to you.
I've got a relatively quick one. I guess it's a rare condition in and of itself, but technically can happen to anyone given the right circumstances. So this is hematidrosis. I hope I've pronounced that correctly. And this is basically a condition, it's particularly rare, in which a human sweats blood.
Wow,
Now, in terms of signs and symptoms, it's basically blood usually coming from
wow.
forehead, nails, and basically just all over the skin, face, chest, back, that sort of thing. Um,
Jeez.
Episodes of hematidrosis, need to make sure that I'm pronouncing it correctly, may basically follow afterwards, headaches, abdominal pain, and that sort of thing. So basically, the blood that comes out of you looks basically a little bit diluted and is like tinged with blood, essentially.
Right.
But
Okay.
some people have bright red blood that comes out of them, which is literally, actual blood as if you cut yourself open.
Mm, mm.
It can result in the skin becoming particularly tender. Now, in terms of causes, it's basically blood vessels underneath the skin in the sweat glands rupturing, causing them to basically explode. So almost like if you
Okay.
strained
Okay.
yourself at the gym, sometimes you can literally burst a blood vessel, is where the phrase
Yeah.
comes from,
Yeah.
and is usually caused and onset because of extreme stress, both physical and emotional. So basically what it does is it invokes your body into, do you know, that like psychological fight or flight response, and basically your blood vessels just hemorrhage in your sweat glands, and as a result blood leaks into your sweat glands and you sweat blood from all over your body. Basically the cause of hematidrosis, I'm hoping I'm pronouncing that correctly, is basically where blood vessels rupture in the sweat glands, and they cause the blood to basically leak into the sweat glands, and then as a result you bleed, but just from everywhere. Again, it's suspected that extreme fear and or stress basically invoke like your body's psychological fight or flight response, where your heart starts beating quicker and all of that sort of thing, and as a result it basically bursts blood vessels in your body, a little bit like going to the gym might do if you decide to lift weights too heavy. In terms of diagnosis and research done, obviously people that have like low platelet counts are more susceptible because your blood doesn't clot when it comes out of you, but there is no connection between platelet count or any kind of like issues with like your blood congealing in relation to this particular condition. It is basically all as a result of stress and anxiety, pretty much.
So it's not that the person will always sweat blood, is it that they are prone to sweat blood? So it's not that every time they sweat it will be blood, or is it?
Yeah, no. So it's not necessarily every time they do, but this happens in. So obviously, everybody experiences extreme stress, but
Yeah.
in particular situations, some people are susceptible to basically bleed blood because,
Wow.
sorry, to sweat blood because their
Sweat.
blood vessels literally cannot take it, basically.
I mean,
So
and
that,
that must be terrifying to see
yeah,
that.
yeah, that's the thing. I
Yeah.
mean, imagine turning up to like an accident, an emergency, and you're just like blood is coming out of not a wound, but literally the skin itself.
Yeah. Yeah.
And to me, that is a terrifying prospect. So there were basically lots of research notes. So it's actually dermatologists that oversee this area of medicine, which I thought was a little bit strange. I felt like it's not really a skin condition in and of itself. But basically, the research that's done previously notes that there are lots of incidences, not lots of instances, but more common incidences of this condition in people that are awaiting execution.
Okay. Okay.
And I guess that's because you are sitting there, it's the context of your life ending, the amount of stress that must be flowing through a person must create such a physical reaction in your body in terms of your heart, your blood pressure, that it must literally burst blood vessels, but in every yeah, but everywhere basically. There was a testament from Leonardo da Vinci who described a soldier who sweated blood before battle,
Really?
and there were cases during the London Blitz.
Wow.
Well, I guess
So it's
again, when you're living in a situation in which you don't know whether or not you might live because you hear an air raid siren and then potentially there's a bomb coming through your ceiling, I guess you could probably understand a person's anxiety and stress there.
so like you said, so it's just that there's so much stress that in certain people the cells can't take it and they just kind of what is it like explode and they have to go it's under the surface of the skin, so it's only got one way to go.
Yeah, basically. So what happens is it's the blood vessels that supply your sweat glands basically just burst, and then as a result, the blood has got nowhere to go but through your sweat glands. So you just excrete the blood through your body like sweat.
Wow. Wow.
Imagine being stressed enough to be in that situation that that's what's happening, and then seeing that happen can't make the situation any better.
No, and that's what I was saying. So even for those around you, I mean, like I said, it must be terrifying because all of a sudden you just got blood coming out of you for
Yeah,
no
yeah.
reason. I guess it's not a condition that needs treatment, but did you say there was anything underlying?
No. So again, like I said, in terms of research already done, there was no links between anybody with any particular blood and or bleeding disorders in having this condition or experiencing it, and there's no necessary treatment, I guess, because it's a case of blood vessels repairing themselves and you not being stressed. They did actually use. There was a group of researchers that used beta blockers, which are the ones that reduce like anxiety. I believe
Mm.
that's like
Yeah, yeah.
the drug that reduces anxiety, and it in people that experience this condition, it had a significant reduction in the frequency of this happening. So basically, it reduced the stress, which evidently must have reduced the body's physical response to the stress, which meant that blood vessels didn't burst and they didn't bleed blood. Sorry, didn't bleed blood, didn't sweat blood.
Sweat blood. Yeah.
Yeah,
Again, and kind of amazing is not the right word to use here, but it is amazing what stress can do to the body. I
yeah.
mean, we see it from everything to kind of putting weight on to kind of making you feel tired to the other extreme, sweating blood. I mean, it's just amazing what the body can do to itself.
Yeah, it's very strange as well because whilst the beta blockers helped, there's research to identify that there was no change in the incidence of cases. So there's an argument that's been made that modern life is more stressful, or we stress about more things in modern life than we did, 200 years
Yeah,
ago.
yeah.
But the number of incidents hasn't increased, which leads researchers to believe that alongside just the nature of stress, there must be some form of underlying cause that means that a certain number of people experience this. Because if it was all stress related, you would have expected to have seen the statistics see an increase in the number of people experiencing this condition, but you haven't seen that, which is again strange.
No, I again never heard of it. I mean, in the past, I don't think it's something you hear about now, but it could probably come under the like the phenomena episode. Have you ever heard of stigmata?
Well, funnily enough, I'm glad you said that. Yeah, basically, this is been associated with claims for the stigmata. So, stigmata is obviously basically a condition where is like the appearance of like the wounds of Jesus Christ
You
and
you
the
bleed from where
crucifixion.
Jesus bled on the
Yeah, yeah.
crucifixion. Yeah, yeah.
So basically, this is kind of an explanation for the claims for instances of where people have experienced stigmata,
Yeah.
which again is a little bit strange because I guess you'd have to link stress in their life somehow to this. But potentially, if you put something that's somebody that's potentially in a situation where they might be have some sort of kind of mental illness background on top of potentially something religious, is it possible that their body could create enough stress that would then cause those wounds, which then they would put forward as, I guess there's probably particular instances in which that's been the
The
case,
only
but
thing I'd say about that, though, is that stigmata is specifically focused in certain parts of the body, isn't it? So I think it's going to be the hands, the feet, isn't it? So
yeah.
I don't know in this instance that you're talking about. I can't even pretend to remember the name of it. Is it like they sweat through all their body? Is it like they sweat from their head? I mean, I guess that's going to be case by case potentially.
Yeah, it depends case by case. However, most common places are the forehead, nails, belly button. But again, all other skin surfaces can be affected.
Nails feels really weird. The head I get because the head is it feels like it's quite thin. I'm touching my head as we're talking about this.
No, but also like
Um,
you sweat from your head a lot. Like if it's
yeah,
hot, you
yeah,
feel beads of sweat coming from your head, don't you?
yeah. But the nails, I find the nails odd. I find the nails odd.
But I don't know whether or not that potentially is like a weak point for like blood vessels, being
Yeah,
like the end of hands and
yeah,
fingers and
yeah,
that
yeah,
sort of thing.
yeah.
Is it like the easiest place for things first? But then again, it's difficult because the whole stigmata issue is like a completely separate like issue
Yeah,
in and of
yeah.
itself. But would somebody who turned around and experienced bleeding of the nails then associate that to be with the hands, which then is indicative of like stigmata wounds? I don't know. I don't know.
Yeah.
Stigmata in and of itself is something that we could have talked about. I don't know if you've got that.
No, no, I didn't. And it just reminded me because I'm saying that's the only thing similar to that I've heard of. And do you know what? Again, it's kind of something I used to hear about a lot when I was a kid, but I just don't hear now. And it's only you
Yeah.
saying that has
Yeah.
reminded me. Yeah,
There was actually one separate to that as well, which I didn't do any research into, but on a separate issue, is like crying blood is also a condition, and that's commonly seen in women, again, strangely, and is induced by kind of hormone imbalances and that sort of thing.
yeah.
But
Right,
yeah, there
right.
was lots of individual cases of people that like wept blood like up to 5 times a day, and again,
Jeez.
the blood could be diluted up to like literally bright red like blood as
Yeah,
blood that you would cut yourself. Really
yeah.
kind of scary things. I don't know what's almost. I don't know if you'd look at something as being if you experienced it, it'd be more scary. I don't know if bleeding through the skin or bleeding from your eyes would be more scary.
It's easy for someone who's not had it, but I
Yeah,
would almost think is bleeding from the eyes easier because you can almost think that maybe you've got some damage there and the blood's coming out of your eyes, but coming out of your skin, I don't know. So like I
yeah,
said, I'm not trying to trivialize it, and it's not as easy for me to say it, but I'd almost imagine like eyes, could you have burst a blood vessel in your eye or something, or can you explain it away as it's blood coming out of a natural place almost, whereas blood coming out of your head or your hands or sort of your belly button or whatever. I don't know. I'd think in my view, probably easier to have it from the eyes.
yeah. Do you know what it is as well? It feels like now that I've read about these things, that it's been trivialized in things like Bond. Do you remember in Casino Royale where the villain Le Chiffre in that bleeds from his eyes? He like cries blood.
Oh, I don't remember that. No.
Sorry,
No.
spoiler alert if you haven't seen
Spoiler
Casino
alert.
Royale in 2006 or
Yeah,
whenever it came out. Sorry, guys. But yeah, I just thought to myself, I was like, oh my God, that's actually a real thing, like in and of
yeah,
itself.
yeah.
It almost made the villain scarier today. Like when I turned around and did the research into finding out about the fact that people can then bleed from their eyes as well. I didn't know whether or not that was scarier in the fact that I'd seen that in a film. But yeah, very, very strange.
But now you know that's a real thing. In your mind, then, do you think that it trivializes it then if they're making it like a Bond villain do that
Yeah, do you know what it is? It's because they've made it like a character trait. But they've made it
of
a
a villain?
character trait. Yeah,
Yeah,
for a villain.
to
So
make it.
this
Yeah,
make him look more evil almost because it's like, oh,
yeah.
this is a terrible thing happening to a terrible person almost. So that's the thing. Now that I've kind of seen it in that context, number one, it makes the idea of that being a real thing more terrifying, but also it's true in the way that you've perceived it because it's a case of, oh, we've made this terrible characteristic, or we've put this characteristic with this person to make them look more terrible and like terrifying, which I feel
If
like
that's what they've done, if that's what they've done, and it's not just coincidence. But yeah, that's the thing. You can look at things now, and it feels like, oh, that's just a film tactic. But now you know you've read this condition, you can now start looking at it and think, right, start putting a couple of things together.
What have you got for your second one?
Right, this is my last one. And again, on the surface of it, I chose this because it sounds like people will have made fun of this one. But when you then start digging into it, you see that it actually
Sorry, it's
can be
not funny,
quite.
but it's just the way in which you said. Some people make fun of this one. I'm just like, whoa.
No, well, no, because again, on the surface, right? I'll get to it in a second. I won't start to keep teasing. But on the surface, it doesn't sound like a bad one, right? It's called auto brewery syndrome. And what it is a condition that occurs when an overgrowth of certain types of fungus in the gut converts carbs into alcohol.
Yeah,
So again, that's what I'm trying to say. It doesn't sound like it's overly, what's the word, taking its toll on people. And you can see how it's going to be made fun of in the press. Like I think I saw something saying, I ate a bag of chips and now I'm drunk, kind of thing.
yeah, yeah.
That's the thing. So basically, you've got, as we know, numerous microorganisms live in the gastrointestinal tract. Bacteria make up the vast majority of these organisms, with fungi accounting for less than 0.1% of microbes in the human gut. Yeast and other fungi feed on the sugars and starches in food, which they then convert into energy. And this process also creates waste in the form of carbon dioxide and ethanol, which is a type of alcohol. The ethanol that fungal fermentation produces enters the bloodstream and travels through the body. People who have auto brewery syndrome may have high blood alcohol levels after ingesting a small quantity of alcohol or no alcohol at all. And auto brewery syndrome can also cause the same physical and psychological symptoms that occur when a person is intoxicated or hungover. So, and before I carry on, I think the thing for me is the fact also that it's got brewery in the name of it feels a bit
Cheap.
demeaning in a way. Yeah,
Yeah, yeah,
cheap.
yeah.
Do
They
you know what I
they've
mean?
like cheapened. This is what I mean. They've cheapened like the.
Severity of it, I
Yeah,
think, or
yeah,
the
yeah,
impact. Yeah.
yeah, yeah.
Again, like the accent syndrome, it can be a result of an underlying condition, and certain medical conditions and factors can increase a person's chance of developing it, and they include Crohn's disease, irritable bowel syndrome, small intestinal bacteria overgrowth, short bowel syndrome, diabetes, obesity, and a weakened immune system. Frequent or long-term antibiotic use can alter the gut microbiome, also resulting in fungal overgrowth.
So can I just ask as well then? So obviously so this is actually a person actually physically gets drunk because their body is taking
Yeah,
alcohol.
yeah, yeah.
So if you blew on a
Sorry, they're
breathalyzer,
not. Sorry, they're not. The body, they're not taking alcohol, but the body's
sorry,
converting.
yeah,
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 it's
yeah, yeah,
producing it.
yeah,
So
yeah.
technically, if they brew, but you wouldn't show as drunk if you blew on like a breathalyzer, would you?
This is a thing I don't know, because ultimately, if it is producing ethanol, that is alcohol.
Yeah, but it's not been
Now,
ingested, so I don't know how breathalyzers work.
but
But I
it's.
feel like
Yeah, I don't know. Now, well, we'll come on to it because it's being used, or it's trying to be used as defense in a lot of drink driving
right,
cases. So
amazing.
it has been used.
Imagine someone using your condition to get away with a fucking crime as well. How
Yeah,
terrible
yeah.
that is.
Another common factor is it can actually also be like a high carb, high sugar. So a lot of people with it often report having a high sugar, high carb diet. The condition is rare, and it was first reported in 1950.
Okay.
Since its discovery, researchers have diagnosed this syndrome in both adults and children. And however, in 2019, the British Medical Journal believed that it is an underdiagnosed medical condition. So I think there's a lot more. Now, the symptoms, as you guess with it, would include brain fog, fatigue, dizziness, slurred speech, mood changes, delirium. It can also cause, and this is the thing, those, along with some of these, could just be, you'd put it off as something else. It could be a number of conditions. So it can also cause headaches, belching, nausea, vomiting, loss of coordination, memory problems, or difficulty concentrating. Diagnose it, you'd have to go for laboratory and observational tests. Some doctors will use a carbohydrate challenge test for it. After a few hours, they'll check the person's blood alcohol level. People who do not have auto brewery syndrome have almost undetectable blood alcohol levels. An increase in blood alcohol levels after the carbohydrate challenge test may therefore indicate the auto brewery syndrome. That would mean that they would be flagged up to me.
Yeah. Yeah. God, imagine that. Sorry, not to make a joke of it, but it's true. Imagine going out for something to eat and then coming back and actually being stopped. Like, there must be incidences in which people have tried to claim this and it's just been flat out rejected, but they've got a legitimate reason for it.
Well, I'll come on to an article shortly, but treatment really, they said there's The main one is going to be dietary change, so avoiding carbs and processed foods. People who restrict carbs can try eat more protein to help them feel fuller. Doctors can treat it with antifungals and in some cases antibiotics.
Okay.
Many people resume their regular diet and lifestyle after one treatment. However, some people experience recurring symptoms even after being asymptomatic, and it's managing your weight and keep reviewing your dietary needs basically. This is a BBC article in 2015 and it was titled "The Man Who Gets Drunk on Chips." And he said, yeah, it's a guy called Nick Hess. Didn't know what was happening at first. It was weird. I'd eat some carbs and all of a sudden I was goofy and vulgar. He would get inexplicably sick with stomach pains and headaches. Every day for a year, I would wake up and vomit. Sometimes it would come on over the course of a few days. Sometimes it was like, bam, I'm drunk. No alcohol had passed his lips, but not everyone believed him. And this is the thing, right? The effect, just like foreign accent syndrome, the effect on other people. At one point, his wife even searched the house from top to bottom to find booze.
Yeah.
So she was looking for him hiding booze.
Yeah.
Everyone was just giving me a rough time until my wife filmed me, and then I saw it. I did look drunk. He suffers, he then came to realize he suffers from brewery syndrome, which is a very rare and controversial medical condition in which, well, we've said that, which yeast in the gut turns carbs into excess alcohol in the blood. But what's it like to live with this odd condition? And if it turns out that many people are being mistaken for alcohol abuse by everyone from their friends to the courts, what should we do about it? Experiences like Hess can be traced back to the 70s when researchers in Japan described a mysterious condition in patients with chronic yeast infections. In papers published at the Times, the researchers described how all of these patients had an abnormal liver enzyme, which meant they weren't getting rid of alcohol from the body. Everyone has a little bit of yeast in their guts, and when it interacts with the carbs and sugar from our food, it produces tiny amounts of alcohol. In the case of the Japanese patients, the extra yeast from the infection and the fact they ate a lot of carb rich rice, combined with the abnormal liver enzyme, meant they couldn't process the alcohol quick enough. Barbara Cordell, head of nursing and health scientists in Texas, who's investigated the condition, she and her colleague Justine McCarthy were the first to identify the disorder in an otherwise healthy individual in the US and verify it in a controlled environment. Um, Her interest began in 2005 when a friend of hers, we'll call him Joe, began experiencing symptoms of drunkenness. He was dizzy, nauseous, and moaned of exhaustion, just like you would after a night on the towels, despite claims that he hadn't even touched a single drop of the hard stuff. His wife began taking notes each time it happened, and on one occasion, Cordell remembers sitting around a table with the two of them and their son administering a breathalyzer test. They all drank a glass of wine and took another test. Joe's result was 3 times higher than any of the others around the table.
Wow.
So yeah, that clarifies it. Yeah, so he was
Yeah.
testing higher than people who drank wine.
Wow.
He'd been admitted to hospital. Joe was fed a high carb. Sorry.
No. Go on. I'll let you carry on because I have got a question, but you might answer it.
Joe was fed a high carb diet throughout the day and blood was drawn every 2 hours. At one point during the afternoon, Joe's blood alcohol levels rose to 120 milligram per 100 ml of blood. For an average sized man, that's the equivalent of 7 shots of whiskey.
That is a lot
It's
of
amazing,
food.
isn't it? So basically, following, I'm going to try skip because I'm aware of the time. On analysis, they found he had 400% more yeast in his gut than a person should do. It was the highest amount of yeast I've ever seen in one person in my entire career. Since then, about 50 people have come forward claiming to have a similar condition, although they expect the true number of cases in the US to be double that. The problem is rarely do any of these people who have the abnormal liver enzyme that you see in the Japanese studies. So rarely any of those people have that. So what's going on? The problem arises when the yeast in your gut gets out of hand. Bacteria normally keeps the yeast in check, but sometimes it takes over. Now, the final thing I've got on this is forensic toxicologist Wayne Jones needs a little more persuading. He recently retired from the Swedish National Board of Forensic Medicine in Linköping, Sweden, after 40 years of medical experience. He says that any alcohol that we produce in the guts through the breakdown of carbohydrates has to pass through the liver before it comes out into the blood. In the liver, we have enzymes that process alcohol, so almost all of it is removed from the blood in a so-called first-pass metabolism. Because of this process, Jones is not yet convinced that people can produce enough alcohol in the blood merely from a yeast imbalance alone to have any medical or forensic significance. He's given his opinion in court several occasions as an expert witness in cases where a lawyer of defendant caught drink driving has claimed that their client has undiagnosed brewery syndrome. Several people over the years have claimed that the alcohol measured in their blood wasn't caused by drinking beer, whiskey, or wine, but by the body itself. A couple of years ago in Sweden, one defence was accepted for the first time by a judge in the lower courts. The prosecution appealed, however, and James was asked to step in to give evidence. The driver was later found guilty of driving under the influence of alcohol. Yeah, and I think it talks a little bit more about that. But yeah, again, really interesting, isn't it?
Yeah, I mean, as well, it's literally a case of like, imagine going out and somebody turns around and offers you like a bag of crisps and you literally can't because you're driving or something. Like that's the level of care that you have in your life when you've got this condition.
Yeah, I mean, you have to then you have to totally change your way of life, either how you deal with having it or how you deal with trying not to bring it on.
Did you mention anything about like the liver in or damage? Sorry, because I wonder if in incidences of people that have this condition, there are more prevalent cases of like liver damage and that sort of thing. Because obviously, the body's producing like pure alcohol, and your liver is responsible for breaking that down, isn't it?
Yeah, so here we go. So it was in the 70s, researchers in Japan, yeah, they found all the patients had an abnormal liver enzyme, which meant they weren't great at getting rid of alcohol from the body. So I think what this guy later on is saying is that most people will have it, so we should be getting rid of the alcohol through the body. So this is for me what that I can't correlate at the moment, where you've had a test where people are saying that they've sat down at a table and watched somebody eat carbs and the people around him drink wine and he's
Yeah,
testing higher to then this guy's saying that you can't use it as a defense because the liver should be getting rid of it.
that still makes no sense from a perspective like that. Legally, that makes no sense. It's like, it's,
It feels to me though that there's enough here and it feels logical that the it's yeast and bacteria converting it into alcohol.
yeah.
We've discussed all the way along. You just need the body just to do something a little wrong or something that it shouldn't be doing to create a condition. So why can't this be a thing?
Yeah, yeah. And it's weird as well because when you look at like the courts, like there is like a defense for murder because sometimes there are people that do things like sleepwalking murders and that sort of thing. Like if you can prove that you've had a history of sleepwalking, so why in instance is it so difficult to claim a defense where evidently there's evidence to support the fact that your body just makes you drunk?
Yeah, I mean, what he said is he said he doesn't want to say that paper that those Texan nurses did isn't right. He just wants to see a lot more detailed information before he accepts the findings as proven fact.
Right, okay.
I guess, you run the risk of can everyone use it as a defense, but then surely it's got to be easy to test it. If someone's gone to the pub, got absolutely hammered, then had an accident and tries to claim that, surely you can do medical tests to prove it or not. I
Yeah,
don't know if you're
yeah.
allowed to I don't know how that works, but surely you can easily prove it.
Yeah, yeah. To me, I feel like that's something that definitely needs to be investigated by courts at least.
Yeah. Again, it's just and like I said, the reason I chose was because it just on the surface it looks like it's not a serious one, but the guy's wife was searching the house for hidden alcohol. Can you imagine how tense or stressful that relationship must have got?
Yeah,
And
yeah,
how
yeah.
many other things we're seeing. It's yeah, it's terrible. It's terrible. And how many times maybe somebody's saying something and they're not believed?
Yeah, yeah, yeah. Because that's the thing as well. You must turn around and say, "I'm not doing any. Like, I don't know." Because the thing is as well, how much confusion must you have when people have said to you that you've been drunk or you like appeared drunk when you've got no acknowledgement of ever drinking anything? Like you
Yeah.
must think that you're going a bit crazy.
Yeah, and it must be terrible. Like I said, imagine if you have gone out and you've had, I don't know, like sort of extra large portion of chips or fries or something, and then you do get pulled over and breathalyzed. I mean, horrific, horrific. So yeah, that was my last one. Auto brewery syndrome.
That was I actually did see that one when I was looking up strange conditions, but I didn't read too much into it. Do you want me to sign off with one more? We'll run
Yeah,
through
yeah,
it quick. Yeah.
yeah. Go on, go on.
This is congenital insensitivity to pain.
Okay, I
Now,
think I've heard of this. I think.
yeah, I think if we were to give it like an overview, and again, potentially where we've seen it portrayed in the film Kick-Ass,
Yes,
Kick-Ass
yes,
obviously gets his powers because he's stabbed, and then he loses some like ability to feel pain in his like receptors or whatever it is. So this is basically a extremely rare condition in which a person cannot feel and has never ever felt physical pain. basically, the reason that this is super dangerous is lots of children that suffer with this condition actually die young. And that's because there are no illnesses that are ever picked up because they cannot feel any pain whatsoever. So, in reality, pain's actually a good thing because pain tells your body when something's wrong. That is literally the
Yeah.
only way to look at it. But in this instance, where you can't do that, you do not pick up illnesses, you do not pick up fractures. And they actually said one of the most common things amongst children in this was cavities and tooth loss and tooth decay because they cannot feel any kind of pain in the mouth either. So
Mm,
obviously, you
mm.
wouldn't know if a tooth you had a toothache or if you had any kind of issues with your teeth. And so they see a lot of like teeth needing to be pulled and cavities and that sort of thing in kids. So there are generally two types of non-response to pain. One's insensitivity to pain, that means painful stimulus isn't perceived. So basically, they cannot describe the intensity or type of pain. So that is feeling absolutely no pain whatsoever. Like there is just no feeling. And then the other type is indifference to pain. So you can perceive that something's happening, but you don't actually feel it as pain. So you can feel that there's something happening, but I guess almost it's like a touch as opposed to something really painful. So someone puts a
Okay.
knife in you, it's not painful. You just know something's happening. You
Big
just cannot.
sensation. Yeah.
Yeah, the body just does not register that as something that's
Jeez. Yeah.
painful. And in reality, I guess whilst them again, like Kick-Ass will have turned around and put this across as like, oh, this is amazing because this person can fight and not feel anything. Yeah, actually super, super dangerous. Again, in terms of causes, no necessary specific cause. There's theories that it's caused by an increased production of particular endorphins in the brain. And it has been treated once previously with a drug called naloxone. And it basically allowed a woman with congenital insensitivity to pain to experience it for the very first time. Which, again, in and of itself, imagine having that condition, never feeling pain, and then
Yeah.
I imagine that if you did experience it, you could stub your toe, and stubbing your toe is one of the worst things in the world, actually. You could experience, the most like insignificant thing, and it becomes the worst thing in the world because you've never experienced any kind of pain
Oh,
before.
that's the first thing that went through my mind was if you've never felt pain for like 20, 30 years, it's got to be so, I say terrifying again, but it must be so unusual. You've never grown up with that. So
Yeah,
how can
yeah.
you process what that is?
And the thing is, I guess there's so many benefits to potentially curing this because what are some of the first symptoms of some of like potentially the worst illnesses that you can have? You've got pain in your back or a pain in your head, like you've got migraine type things, or you've got a pain in your chest, that sort of thing. That is something that is just not picked up whatsoever. You have got no early warning sign for anything ever being wrong with you. And at some point, obviously everybody's health fails them at some point. That's a pretty significant thing to be missing. I don't know if potentially people that suffer with this condition actually have a reduced life expectancy, but like I said, I did read that it's common for children that have this condition to basically die young because they can't pick anything up. And again, if you go to a doctor, how does a doctor pick anything up? Because you don't respond in a way that's indicative of you experiencing anything. That first question that you get at the doctor, if you ever go to them with a particular issue, oh, you got any pain anywhere? You go to accident and emergency, have you got any pain anywhere? And you just can't answer that question.
Sorry, I can't remember if you said at what point then would this be diagnosed? Because if at what point do you say my kid never cries or my kid just never
Yeah.
seems to get hurt? At what point do you turn that into can they actually feel pain?
Well, this is the thing, and I think that's why it's an issue. Do you know, like your perception of kids, like you see them fall over, fall off slides. Sometimes they just bounce up because they either feel embarrassed and that sort of thing, and they
Yeah,
like brush it off. What needs to happen for you potentially as a parent to say that's not normal?
yeah.
Like, does it take an arm being like having a compound fracture or something like that, and you've got no reaction from a child potentially? Because that's again a lot of the research found is that it's lots of things like issues with teeth or it's potentially fractures. So I've broken my elbow, but I still had the facility to move it because the bone wasn't snapped, right? But
Yeah.
I felt a hell of a lot of pain when I tried to move my arm. People that had this condition would have no acknowledgement whatsoever of that pain in their arm, even though the bone's broken.
And do you know what, right? Again, just because everything we've done, we focus on what the bad things can be on it. Can you imagine if a kid maybe has gone in for a random X-ray or something or scan? I don't know what position that would be in, but then they find they've got like a couple of old broken bones.
Yeah.
And do they look at the parents?
Yeah. Yeah. Could you imagine? Yeah.
If it's never been reported, it's like, have you covered something up? I mean, I wonder if that's ever come about. But you'd think by that point, something must have come out that the child can't feel pain. I just find that it's just pain is, and this sounds terrible, pain is so fundamental to being
Yeah.
human, isn't it?
Yeah. Yeah.
That you can't
Yeah.
imagine not having it.
It's a really, really strange phenomenon.
Like I said, three bad things. One, getting dangerous, doing dangerous things as a kid because you don't know that putting your hand on the stove isn't going to burn you. Two, yeah, undiagnosed conditions like you've broken an arm and it just heals over, or you fractured an arm and it heals over. And then three, yeah, not being able to give early warning signs for a condition. That's yeah,
Well, I'm actually glad that you mentioned burns as well, because again, one of the most common injuries amongst people with congenital insensitivity to pain is burns, because you would put your hand on a boiling tray out of the oven and there would be no pain whatsoever. You would just know until you basically either smelt something or looked at your hand and the skin was torn off your hand, because you cannot physically feel that. And that is a weird thing to think about in the context of, like, if I touch that tray that's come out of the oven for half of a second, I feel it, but
yeah,
imagine
yeah.
being able to pick that up and there is absolutely nothing that happens. It's like you're picking the tray up when it's cold coming out of the dishwasher or
And oh
something
my God,
like.
that just makes me cringe at what, or real in horror what they must do. Because this is where I admit, like, the stupid stuff I've done. I remember once going to get a tray out the oven and being so absent-minded that I didn't put the oven glove on, and I grabbed it, and literally, it's like you said, it was for half a second, but my God, the pain I felt. So could you imagine if you're able to hold on to that, and
Yeah.
what must that's still got to damage the hand. But at what point do you realise that it is damage? Like you said, is it when you smell something, which I know sounds disgusting, but that can be the only thing, right?
Yeah, this is what I mean. So this is the thing. All of the traditional indicators that you would have for not doing something or doing something dangerous don't exist. So you have to rely on everything else, whether it just be your mental awareness of a situation, because you must have to be so careful. You could get hit by a car and just have no, or fall off a bike potentially. Do you know what I mean? Like, there have been instances where people have just fallen over and, you've smacked your head, but all of a sudden you feel ill later on in the evening and you realize that you've done damage. You just have no acknowledgement of that whatsoever. Like, but what do? Do you have to go and have a scan every time you've fallen over? Do you have to go and have a scan every
Yeah,
time you've knocked your head? It's the weirdest thing. Like, with people that have that condition, you'd feel like you just want to put them in an MRI machine every 6 months and just scan
yeah,
everything.
yeah, yeah. I wonder if that's the answer to our earlier question was depends on the severity of the injury you have. Like at some point, if you've damaged a bone enough, even though you can't feel pain, you might find that you can't move the arm or that you can't move those fingers the same way
Yeah,
you
yeah.
could. So I'm wondering if that can be, which again isn't the greatest thing to rely on, because you could be you could be damaging it more. You just don't know
Yeah,
it.
yeah, yeah.
Not good, is it?
Genuinely very strange. And there's actually a particularly interesting incidence of this. So there's a particular village in Sweden, and it's called Vitangi or Vitangai, and it's in northern Sweden. And there's nearly 40 cases that have been reported there. And as
Oh,
of 2010, so I know it's still 10 years ago, however, there was only 780 people living in the town in 2010. So that is
oh,
an incidence of 5% of the town.
yeah. That
So
feels unusual, doesn't it?
yeah, genetically, there must be something. So, again, there's basically genes that are implicated. Now, I won't get into the science because there's just lots of letters and lots of numbers all relating to particular genes. But again, studies showed that there was like 6 members of a particular family with inherited pain insensitivity, and there was basically a mutation in a particular gene, which changed, again, going to sound like a computer, basically changed the encoding of a particular receptor that gave your
Right,
body the sense of pain.
right.
So it's basically all to do with genes, DNA, and the fact that there's just something that is, I guess, not saying it's not wired correctly, but is wired differently, that basically just stops your body from feeling any kind of sensitivity to any receptor in your body. It does make me think though as well, like, do people that not experience the pain also just, like, what is your experience of, like, touch, for instance? So can you feel a person touching you, and is it just a case of the physical pain in and of itself? So you can feel the touch of a person's hand, but when they punch you, you can feel the touch of the hand, but just not the pain that comes with it. It's all very strange.
What about the other way then? If someone's slowly pinching you, but it gets harder and harder?
Yeah,
Because
like,
I'm
do you
I'm
feel
thinking a
like a
punch, there's an impact, but if you were imagine you weren't looking and someone pinch, you might feel the sensation, but there's a certain point where once you start squeezing, that starts hurting. So how would that feel to that person? Yeah,
yeah, but this is the thing. I mean, if they weren't looking, if a person was with this condition wasn't looking, you could bring a hammer down on their hand,
yeah,
and there'd just be nothing. And like I said, actually, way more dangerous than you would ever imagine. And also, anybody with congenital insensitivity pain, if you do want to make a complaint against Kick-Ass, I'm all here to support it now because I've learned about your condition. Because again, it's a bit like the bleeding from the eyes thing. It's been used as like a gimmick
yeah,
to
yeah,
a
yeah,
to
yeah.
a to a superhero character. But yeah, very very strange one to end on.
Okay, cool.
Yeah.
So before we go, the new feature.
Yeah, before we go, the new feature. So this is actually something that I forgot in the last episode. Did we do before we go in the last episode?
Yeah, I did the fact about gold in the earth.
Oh, that's the one. Yeah, and all the gold in the earth. So we need to find a way to dig to the center and the core of the earth. In this week, I'm actually going to bring up something from the previous episode, and it was a law that I forgot because we were so intent on talking about not being able to take cows down the motorway in the UK and not wearing suits of armor in Parliament and stuff. But the law that I saw, and it was utterly absurd, and also I'll have to forward the sketch to you, Dan, that I saw because I forgot to do it the other day, is that it is illegal in China to be reincarnated without the express permission of the government.
There you go.
And I just thought that was brilliant because in and of itself, like, how do you regulate that? Like, who do you walk around to every newborn and think, this looks particularly like Dave who died last week?
Did you
But yeah,
get
that's
permission? Did you get permission? Well, I want to add it before we go as well. I know it's not actually at time of recording, we're not too long after releasing the episode that you've just spoken about, actually. But I've had a few comments and reviews. So, like we always say, I really do. We encourage you to leave a review or get in contact with us for any reason you fancy, even if it's just say hello. But we've had some interesting comments. So, Leo Allen from Voluntary Input has given us 5 stars. It's all on Good Pods. He said, "Good thing he listened to the episode. Now he knows what time he can walk his cow." Chatsunami's given us 5. Kay from the F My Work Life podcast. She's picked up on something you said. She goes, "Yeah, absolutely. Lions deserve to be disappointed in Top Gun as well." um, that was off something you said, I think. 5 stars from Decaying with the Boys. 5 stars from Josh at Talking Smack. Antonio from the Cultworthy has said he's probably guilty of suspiciously handing a salmon. Arrest him. So if any police are listening, there you go. Justin from the Movie Wire Show has given us 5. Austin Boy has given us 5 stars, and Shane has given us 5 stars. So I just thought it'd be funny, yeah, some of the comments we've had on that episode so far. So
some of the laws were pretty ridiculous, to be
I
fair.
think there's plenty of
Uh,
scope for part 2.
Maybe we should actively go out and just try and break as many ridiculous laws as possible before and see how quickly we can get arrested.
Actually, I've just remembered. Yeah, well, I don't encourage that, by the way. I've got the Oki Bookcast, who I was talking to on Twitter today, actually. So this is on tweet. It said in Oklahoma, it's illegal to make ugly faces at dogs, take a take a bite of someone else's hamburger, which I can agree with because I don't like sharing food at the best of times. Wear your boots to bed, but also whaling is outlawed. Now Oklahoma's a landlocked state, so I think
Amazing.
there's definitely
Amazing.
scope to come back to this. So yeah, sorry, I'm done now. I'm done.
Amazing. That one is actually class, to be fair.
Yeah.
It's like turning around to a Brit and saying it's illegal to hunt camels. On that note, I'm going to hope to not destroy the intro like I destroy the outro like I destroyed the intro. I've already done it. I'm going to leave you. If you do have any of the conditions as mentioned, or know anybody that has any of the conditions mentioned, I think that would make a good episode. To be fair, so that would be cool to get someone on if you had congenital and what did I say? Intolerance to pain, the one that we talked about at the end. So you can send us a tweet at casting views or drop us an email at castingviewspod@gmail.com. And as always, we will end with, we know there are many podcasts from which you can choose. So we thank you for listening to Casting Views.